How's everybody doing? Okay, we're doing it, part 3. So we have covered eating out and why I don't think it's a good idea. We have covered stress and sleep, and this part we're going to cover medication. Um, Medication is a big deal in someone's health and wellness journey when it comes to losing weight, okay? And we need to remember that it is a side effect. It is it's just something that isn't talked about a lot. Like the doctor doesn't come to you and say, we're going to put you on this antidepressant and it's going to cause you to gain weight, or it's going to make it really hard for you to lose weight. I'm just giving you a forewarning. They don't do that. They write you a prescription, they send you home. It's your job to look through the side effects and research the medication, but a lot of times we don't do that because why? Because we're trusting the people that are giving it to us to disclose everything that needs to be disclosed to us. And so weight gain is something that we don't think about when it comes to prescription medications or even over-the-counter medications, you guys. So I'm going to run through some of the most common medications that can cause weight gain or can cause the inability to lose weight. Antidepressants is a huge one. Now, there are a few out there that actually can cause you to lose weight, but typically those aren't the ones that are prescribed. Paxil is the number one antidepressant prescribed that actually causes weight gain. Corticosteroids, let me just get that out. We all know, if you've heard of, steroids, prednisone that causes weight gain. Here's the deal. Doctors will tell you that you need to be on it long term for that to take place. It is not true. Everybody's genetic makeup is different and everybody is going to react to medications differently. Some people, and I've seen it, they are on a prednisone, a steroid, for a week to 2 weeks and they put on weight. That puffy face that we see sometimes might not be happening just yet because they haven't been on it long enough, but the weight gain is there. I have seen it. I have had clients that have been on short-term bursts and they have gained 5 pounds and they can't get it off. So it really does directly affect weight loss and weight gain in most people. I'm not going to say all people because, like I said, everybody's genetically different. Antipsychotic medications used for bipolar disorder, antihistamines, Zyrtec, over-the-counter antihistamines for allergies, even prescription ones. Yes, they can cause weight gain in some people, and they can make it really difficult for you to take the pounds off if that's what you're trying to do. Beta blockers, insulin, birth control pills, migraine prevention medications, pain medications used for seizures, or just pain medications in general. Sometimes those cross over. Gabapentin is one of them. It's an anti-seizure drug, but they use it for neuropathy pain. Well, it's known to cause weight gain. Anti-inflammatory drugs for arthritis, skin disorders, blood disorders, respiratory issues, even over-the-counter ibuprofen. If you're taking it all the time, it can actually cause weight gain in some people, or the inability to lose weight. Am I saying go off of these medications? No. I'm just saying be aware of all of the surrounding factors that could potentially be causing unwanted weight gain or making it really difficult for you to take weight off. I mean, if your diet is spot on, you're working out, your water intake's good, you should be seeing the pounds, reducing, and they're not. You need to take a look at any prescription or non-prescription medications that you're taking. So this is just to throw some of them out there. You always have the option to go to your doctor and say, I'm just curious if perhaps we can switch my medication. This one just isn't working for me. Is there an alternative? But do the research, sit down, start Googling, because we all have access to Google, the different medications that you're taking, and find out if that is a side effect, because it could be something that is really hindering your abilities to shed some weight if that's what you're having a problem with. Or, you've gained a few pounds and you just can't quite figure out why, because everything is so spot on. So anyways, that is episode 3. Medications absolutely play a role in healthy weight management and weight loss. So those are just some of the top medications that can contribute to that problem. Anyways, if you have any questions, let me know.